Okay, so if I just introduce us, there's myself and Kathryn Fox, there's Jonathan Marsden and Matthew Cripps, who is in the background somewhere, who will be presenting today on our clinical simulation reimagined through contextualisation of clinical cases. The three of us are all from the dental school. I think this morning perhaps is quite dentistry heavy because I think you've got another dental school presenter later. Anyway, in this talk this morning, we're going to be focusing on the use of e-portfolio and student self-reflection in supporting student learning. So in order to learn clinical aspects of dentistry, students are usually taught the basic technical skills in our operative skills laboratory, which you can see on the picture of the top right of the screen, where the students work on simulators commonly known as phantom heads. So following a period of deliberate practice, the students then are assessed by a clinical safety panel. And if they're deemed competent, they're then allowed to undertake procedures on patients at the dental hospital under obviously close supervision of a qualified dentist. So this then allows the students to contextualize their previous learning within a clinical environment and incorporates other developing skills that they need to acquire, such as communication and patient management. However, as we all know, March 2020, everything changed. All the patient treatment in the dental hospital ceased and the students were sent home. This obviously caused major difficulties in a practical course such as dentistry, but fortunately our students were allowed to return for face-to-face teaching in September of 2020. However, as the standard dental drills that are used in dentistry generate aerosols, even with enhanced PPE, we weren't allowed to treat patients on our undergrad open plan clinics. You can see a picture of one of the clinics there. So we had a problem. So without patients, how could we contextualize the clinical skills teaching and ensure that we continued with the application of learning for our students? So we explored the reciprocal triadic factors of Bandura's social cognitive theory with respect to behavioural, cognitive and environmental factors in an attempt to support the self-regulated learning and encourage the self-efficacy of our students. So in order to address this problem, we developed a series of simulated patient cases, and these consisted of three parts, as you'll see on the slide. So there was preclinical, there was clinical replacement as it became, and post-clinical activities. So every 2 weeks, you'll see on the right of the screen there that there's a workflow that we went through. And every 2 weeks, details of a new simulated case study will be released on Vital, and the students will be provided with a link to their e-portfolio on PebblePad. They would then complete the relevant sections of the portfolio and watch an asynchronous video about the case and reflect on their understanding of the key issues. Jonathan's going to talk a little bit more about that later. The students then attended their timetable clinical sessions where they had a patient simulator rather than a real patient in the dental chair. They were expected to undertake the treatment according to the treatment plan agreed in the video. And following the session, the students then had to go back to their portfolio and reflect on how the treatment had progressed and set some goals for the future as to how they would move on. So what we're going to talk about now, we're going to go through each stage in a little bit more detail. So first of all, the e-portfolio. So this was developed on PebblePad to allow ease of access for the students via the app. So the interactive workbook could be used by the students at home, on a phone, a tablet, as you can see, on a train or a bus, but also then to undertake the preclinical activities, but then also then it could be used within our NHS surgeries, as you see on the other picture, on the computers there. So they could undertake the preclinical activities at home, but then later as a point of reflection and discussion on the clinic. So Matt, who's our lecturer in technology enhanced learning, is now going to talk you through the portfolio.
Thanks, Kathryn. So we've just got a short video that Johnny's hopefully going to play for us, and I'll just talk over the top of that, if we can get it playing, that is. Yeah, so this is a quick, short screen grab. As Kathryn mentioned, the problems we've really had to deal with were we needed ease of access to the tool, and it needed to work on the NHS machines. So after looking through it, we thought PebblePad and doing some testing, PebblePad would be ideal. As you can see here in the screenshot, we're actually navigating through a case. So the cases were kind of broken down into specific sections, and we use PebblePad to kind of time release the content. So as you can see, this is SQ001, which was the first patient that was released. And the student has then just looked at that patient history and would be writing in the relevant medical history for that patient. So we obviously designed a template within PebblePad, which allowed us as their kind of tell team. So it wasn't only me, it was me and a few other guys from our team to kind of work with the clinical team so they could provide us with the information and we could kind of essentially put it into a template and the students would be able to complete it. And as you can see here, this student is kind of navigating through the sections. As you can see along the top, there were 8 cases, I think, that we released in the end. So the reason why we chose PebblePad was obviously because students were able to access it on their own devices and then also access it when they came in the building. We also managed to set it up so that it auto-submitted, so that students didn't have any problems saying they hadn't submitted their work or they couldn't access it. And it also allowed us to kind of review students' progress. So at first we wondered whether students would get on with the technology. As we'd used PebblePad previously within the school, we didn't really have any problems with that. But then later on, using PebblePad, we're actually able to run off reports to see how students were engaging with the different sections of the workbook, whether they were completing all the appropriate sections to the case, as the template was generic, so various sections needed to be completed. And yeah, I think that's kind of it for the portfolio. If we want to pause the video.
Thanks, Matt. So as mentioned earlier, after completing the preclinical activities, students would watch an asynchronous case discussion video delivered by an experienced practitioner who explored the details of the simulated patient case. This was more than simply stating the answers and went into detail about different treatment options and the implications of these. Students then reflected on their own performance relating to the preclinical activities such as risk assessment, diagnosis and treatment planning, and then with timetables for clinical replacement sessions in real clinical areas. Steve DeBoo and the team are going to talk more about that during their lightning talk this afternoon, but students would essentially treat the simulated patient, or in dentistry's case, the phantom head, as if it were a real patient, presenting their patient to the supervising tutor, detailing medical history and identifying potential risks, discussing the proposed treatment for the session using their self-devised treatment plan, accessing the e-portfolio. During these sessions, students would receive coaching style feedback from tutors, both verbally and via the developmental software liftup, which students could reflect on at home or on their mobile devices as well. After these series of simulated clinical replacement sessions relating to each case, a student would self-reflect on their performance during the session on areas such as knowledge application and clinical skills, using not only their own experience and views, but the tutor feedback. From this reflection, they would set up goals for themselves to help aid their future development. So self-efficacy is a person's belief in their own capability to succeed at tasks, relating to what a person believes they can do. I'm sure we have all met people who say they are bad at maths, and if they're presented with a math problem, they would probably not even try to pick the pencil up to try and solve the problem. That's because they are inefficacious. They believe they lack the ability to successfully accomplish the task. In other words, in the words of Albert Bandura, unless people believe they can produce the desired effects by their actions, they have little incentive to act. So we wanted to instill a high self-efficacy in our students, developing confidence in their own abilities. We also wanted to develop students' skill of metacognition, which is awareness about one's own thinking and learning, and use this to help them become self-regulated learners. The model on the right-hand side, proposed by Zimmerman, consists of 3 phases. Forethought occurs before the efforts to learn, and this is where self-motivation, such as self-efficacy, beliefs, fits into the model. Performance is the processes that occur during the activity, and self-reflection is where the learner makes a judgment regarding how they performed, usually against a given standard, And this leads to a self-reaction which may be positive or negative depending upon the judgment of one's performance. So to aid student self-reflection, we ask students to use Rolf's reflective model, which is what, so what, now what. And we felt this linked quite nicely with Zimmerman's self-reflection model. So what, the student's performance on both preclinical and clinical activities. The so what is the self-reflection on this performance, and the now what is the forethought on future development and how they can improve going forwards. Once students had completed the self-reflection, they were encouraged to create SMART goals for which a template was made available. These were only viewable by the student and could consist of personal, academic, or clinical goals. Following the series of 5 simulated patient cases, we sent out a survey to which 89 students responded, a response rate of 65%. As we can see, the simulated patient cases generally scored really, really highly. The students found that the case-based nature had been more beneficial to their learning than if they had just been timetabled for undirected practice, lacking context. They found the e-portfolio well-structured and easy to access, and the case discussion videos and tutor feedback helped them to identify areas for development. And after having participated in the simulated cases, over 96% of students either agreed or strongly agreed that they felt more competent to perform these skills in a real-world situation. One area that rated slightly lower was the students feeling the self-reflection and goal-setting exercises helped them with their development, which we'll discuss in more detail in a second. These are some of the quotes taken from the student evaluation feedback. As we can see, one student really liked the pebble pad layout. Another found the cases to be an excellent clinical replacement activity, improving their skills, and they appreciated working through the treatment plan from start to finish. One student thought the simulated patient cases helped them to identify areas where they thought they wouldn't necessarily have struggled or practiced without this directed learning. And as we can see, students felt to help build their confidence and understand the context of treatment. With one student saying they love their sessions and feel more confident in their clinical skills than they ever had before. So if we revisit the question, if students found the self-reflection and goal setting useful, we can see although 47% agreed or strongly agreed, 37% were neutral, and 16% disagreed or strongly disagreed. Possible reasons for this could be that as they were 4th and 5th year dental students, they could have well-developed internal self-reflection mechanisms and be reflecting in less formal ways. Students could have lacked confidence using the reflective model, and perhaps with more teaching, we could have improved on this. Perhaps going forward, we could link with the academic advising system to try and improve mentorship and coaching, particularly with relation to self-reflection and goal setting. A paper by Dryson et al. In 2005 discusses the successful use of reflective portfolios in undergraduate medical education and suggests 4 principles: coaching or mentorship, a good structure and guidance for completing the portfolio, providing students with sufficient experiences and learning materials for them to reflect upon, and summative assessment of the portfolio. Although we agree with many of the principles put forward by Dryson et al., our thoughts are that summative assessment of the reflective e-portfolios may actually be counterproductive, inhibiting student honest reflection, and as they become a piece of work to be marked. This is also in conflict with principles of self-regulated learning and does little to prepare students for life as a professional. These are our references, and we are happy to take any questions. Thank you.
That was fantastic. Thanks very much, guys. We have one question straight off from Helena, and she just asked, was the portfolio assessed so in any way, shape, or form?
So although the portfolio wasn't formally assessed, it was subject to monitoring of engagement, and those students that were found to not be sufficiently engaging with the portfolio were contacted to see if there was any barriers to learning that could be removed.
Sure, great. Okay.
I think in a way we could, because the students then had to come into the clinical area and have the conversation with a member of staff, it was fairly obvious with those students who hadn't engaged anyway. So even though it wasn't formally assessed, there was a second part to it, so they would have to discuss it. So in a way, they all did engage. Somebody did a little bit of an extra push, but actually all the pebble pad, there was no problems with pebble pad, was there, Matt? they were fine with the IT
Yeah.
side of it. Just some needed a little bit of extra encouragement.
Excellent. Excellent.